Hello, and welcome to Module 7 of the Comprehensive Care Management Standard for the Community and Clinical Integration Program of the Connecticut State Innovation Model. Module 7 is entitled Monitoring the Individualized Care Plan. So why do we monitor the Individualized Care Plan? Well, for several reasons. We're looking at progress toward goals. How engaged is the patient? Communication between clinical and non-clinical providers, and management of any care transitions. Monitoring of the care plan is one of the most important components of successful care coordination. Once the care plan is established, regular monitoring of progress or lack of progress toward the person-centered goals is essential. Frequent engagement with the patient helps to evaluate their satisfaction and comfort with the care plan and reminds them to work toward their goal. Regular communication with the clinician and non-clinician service providers ensures that the care plan is proceeding as specified, or if any gaps or questions are being addressed in order to meet the patient's needs. The care manager should also be involved in managing transitions of care between and among healthcare providers and settings, including providing follow-up after an ED visit or a discharge from a hospital, skilled nursing, or other facility. Just remember, monitoring of progress is important, but monitoring of hiccups, if you will, in the patient's plan of care is also essential in order to identify where we can be of assistance and get the patient back on track. So how frequently should we monitor? A regular schedule for the type and frequency of monitoring activities should be established. We need regularly scheduled contacts. We can do this in many ways. We can have telephonic check-ins with the patient to discuss progress or, again, lack of progress towards the person-centered goal. Again, if there's a lack of progress, how does the patient get back on track? How can we help them address and overcome any barriers? We can do home visits. We can have meetings with the care manager in the medical office at the time of a regularly scheduled appointment. How frequently are we going to do this? How often do we schedule monitoring activities may depend on the individual's overall status, the stability of their situation, their needs, their goals, their progress. For example, someone who has just been discharged from a hospitalization may need to be more closely monitored while they adjust to their new medications, etc. For a stabilized patient, a minimum frequency of a monthly contact is recommended. When do we complete reassessments? Regularly scheduled in-person reassessment visits should be conducted for patients with ongoing chronic care needs. The frequency can vary as noted above, but a recommended interval would be at least every 6 months. A standardized tool should be used, preferably the same tool that is used for the initial assessment or an abbreviated version of the same tool. A new person-centered goal would be created at the time of the reassessment visit. Tracking outcomes. A standardized format for documentation of all care management activities is recommended. A standardized care plan that is accessible to all members of the care team enables everyone to view changes in the plan over time, such as discontinuation of services that are no longer needed, medications that have been discontinued, or addition of new services or medications to the plan. The use of a goal progress sheet is one way to track progress toward the person-centered goal at the time of each regular monitoring contact. Let's check in with Mrs. Ramos at the end of her 6-month assessment period in her care management experience. Through her attendance at the Live Well Diabetes Self-Management Program, she has learned about nutrition, how to manage her diet, the importance of self-monitoring, and how to communicate with her healthcare providers. She has learned the warning or red flag symptoms that she needs to report to her physician, and she feels more confident about communicating with him. Her blood sugar readings and A1C levels have stabilized, and she has not been to the emergency department at all in the last 6 months. In addition, her community health worker has assisted her to apply for food stamps and other financial entitlements that have made it easier for her to afford nutritious food that she needs in order to care for her diabetes. He has also connected her with the local Spanish Community Center, where she now brings her grandson to a playgroup twice a week. They both enjoy the socialization that this activity provides for them. Mrs. Ramos did successfully meet her goal of losing 15 pounds and is setting a new goal of taking a walk around the block 3 times each week. Overall, her health status is stable. She has stayed out of the hospital and emergency department, and her satisfaction and quality of life have improved since she has become involved with the comprehensive care management program. I believe we can see from Mrs. Ramos's story that really a coordinated, well-planned care plan for this patient has enabled her to become more self-sufficient, healthier, and has actually reduced costs to the healthcare system.